and motivating lecture. Please have and enjoy. I don't want to eat much of your time. Thank you. Thank you very much.
मानिक P-Manic का है, मानिका ने नहीं, मानिक जो Dr. Cherry ना, who just spoke now, Cherry, Cherry ना क्या लिखा? Okay, ठीक है. Good evening. So don't be a silent seater, be interactive. Otherwise, organizers have given such a good tiffin, you will sleep. So if you are interactive, then you will not sleep. So be interactive while discussion. So at the outset, I extend my regards, gratefulness, thanks to this association, Telangana Homeopathic Medical Association, who is doing a great job for the cause of homeopathy. Actually, just 5 minutes back, I learned they are running the dispensary, organizing some study courses for non-homeopathic, which is also going in London. In London, they are organizing short courses for veterinary doctors, BSc nurses, dentists, even senior agricultural officers. Likewise, they educate them, they disseminate homeopathy through these literate persons. So the same thing is going here. I'm extremely happy that such an association is still existing in Telangana, and we must all support their cause, their work, and how to extend this association. So, most respected President of the association, Dr. K. Gopal Krishnan, General Secretary, Dr. Durga Prasad Rao, who contacted me several times to come here, and past President, convener of this seminar, most respected Dr. P. Sampath Rao, with whom I worked with CCH, Central Council of Homeopathy, 5 years back. He is a very potential person in the CCH, and Dr. Venugopal, Dr. A. Manik Prasad, and all learned delegates, Professor M.N. Cherry, who gave my introduction, but it is to some extent more heightened, which is myself, not much more than what I am. So I thanks to all of you, these land delegates. Good evening. 25th September is the birth anniversary of Dr. Jaisuriya. Yes or no? Yes, sir. Yes. So this is today is a great day. You will be happy to know that homeopathy introduced in Parliament by Dr. K.G. Saxena. Do you heard his name? Yes. His birthday is also today. I got the call in Delhi. He is the creator of IISP, Indian Institute of Homeopathy Physicians, where I am the National Vice President. We are organizing their birth anniversary today in Delhi in a very big way. They invited me, but I told I have already given words to this association much ahead. So excuse me. So this is a great day today. And after seeing Dr. Jaisuriya's contribution, I am extremely happy that what our chief guest told today, persons, they are giving a lot of contribution to society. Being an allopathic physician, he could able to practice homeopathy and establish homeopathy and so on. So this is a great day today. Let us pay homage to Dr. Jayasuriya, who founded this association and also have a great contribution to homeopathy, and Dr. K.G. Saxena. With this short thing, let us start our session. I have deal with two topics today, if time is possible. Otherwise, I will deal with one topic. What we will discuss, it should be interactive, it should be discussed. And if any doubt, I will show you some cases. You can ask me on the cases, on the reports. I will show you some evidence-based reports. I'll be happy if anybody can challenge my reports, or I can interact with me. Then a prescription could have been like this. Why you have given this? I'll be happy. Okay. So my first talk is on homeopathic approach to space occupied tumors, pre-malignant conditions, and early malignant diseases. We cannot say all malignant conditions. So I will demonstrate two cases of very early malignant, just waiting to be converted to malignance, which could be reversed to normal, to space occupied tumors with MRI report and biopsy report, which reversed normal, and one early malignant case of pulmonary cancer, just invading the alveolar wall, reverse that. In all these cases, you will see, after to see that, in all these cases, they reverse back to what show the reports. Chronic inflammation. And the biopsy report shows features of chronic inflammation along with macrophages. So when there is a cancer, it leads from chronic inflammation to malignancy. And that we remember headache stuff cure. You see in these cases, they just follow the headache stuff cure and comes back to the same chronic inflammatory stage. I remember Dr. Sampath invited me on seminar perhaps 10 years back in this Hyderabad, for which association I forgot. He invited me. Same association. So we are meeting again after 15 years. Okay. Thank you. So, as we all know, next to heart attack, malignancy is the next leading cause of mortality in the globe. Yes or no? Present lifestyle, like taking gutka, alcohol, smoking, prolonged exposure to computer, mobiles, faulty food habits, exposure to carcinogens, increases the prevalence of cancer in population today. Radiotherapy, chemotherapy, surgery is the usual approach of allopathic doctors to malignancy, pre-malignant conditions, which is still a challenge to cure or stop malignancy. In homeopathy, we often observed effectiveness because of our holistic approach. Cancer is not a local, I'll discuss in the last, it is not a local disease. It is a constitutional disorder. It requires holistic approach. You cannot remove a tumor and cure it, which is done by allopathy. So I will just show you one study of my case records, which cases I could treat by homeopathic medicines. And these case records I will show you with a pre-treatment and post-treatment. What was there before, what was the biopsy report, what was the MRI report before treatment, and what happens after my treatment, which will give us confidence, yes, homeopathic doctors should treat malignancy cases without denying. Many of us are denying that no, we can't treat malignancy, you go and operate in the early malignant cases. So all these cases are followed with CT, MRI, and histopathological reports. I have dealt with, see, carcinoma larynx, cancer cervix, cancer mouth, gallbladder cancer, cancer tongue. Total malignant cases I treated benign space of time tumors, space of time somewhere big meningioma in the brain that causes lot of damage to the brain tissue and causes lot of loss to the body. So meningioma, microadenoma, uterine fibroid, PCOS, pseudopancreatic tumors of pancreas, gallbladder polyp, and pre-malignant cases which are actually amenable to astrocytoma, glioma, cervical interepithelial, neoplasia, grade 1, grade 2, leukoplakia, pleomorphic saline gland. What I observe, many senior practices are there. I am sure you are getting all the cases in practice. Yes or no? Yes. You are getting all the cases in practice. Sometimes you deny, sometimes you accept, sometimes you reject. Selection of medicine, I will tell you the last, but in the beginning, strictly according to the principles. Patients are assessed clinically and radiologically in 1 month interval. See the improvements in a nutshell, with a lot of things I have to tell you. Just below, in case of benign disease, out of 15, 8 marked MI means marked improvement, PI means partial improvement, not improvement. Out of 15 benign cases, 8 are marked improvement, 4 has partial improvement, and 3 has no improvement. Out of total 15 pre-malignant cases, only 4 has marked improvement, 8 has partial improvement, and 3 not improvement. Coming to so see the result. Meningioma 2 complete out of 2, 1 is complete. I show this case. Microadenoma, remember, it's a very good case for women. Microadenoma, in these cases, Victoria, prolonged high, not in serious nature, getting this case. And I can give a guarantee to your patient that microadenoma can cure. Similarly, pseudopancreatic tumor is cured by homeopathy. So there are pseudopancreatic tumor, must get it. Yes or no? Not get it. You can fibroid polyp. Similarly, astrocytoma, glioma, astrocytoma not improved very much. Glioma in partial improvement, and CIN1, which is a very pre-malignant conditions. If not treated, CIN1, 2, 3, you will almost have this cancer. Yes or no? And CIN1 I cured in a lot of cases, and CIN2 only 2 cases passing. And salivary adenoma, which is a very strong pre-cancerous state, is cured by homeopathy. Coming to malignancy, not very much. I can say I have very much result in homeopathy. Out of 15, 1 is completely cured, 6 partial improvement, and 8 not cured, but quality of life is very much very. I'll show you what is the percentage. Coming to case presentation directly, I am not going to the statistical portion. I'll first show you a case of petrous meningioma. See, a case came to me. Name should not be there according to the ethics, but I written it. A case came to me complaining of trembling, twitching of muscles of just 90 symptoms. Trembling, twitching of muscles of right side of face, paralysis and numbness of right side of face. Petrous meningioma affecting the petrous part, affecting auditory area of the brain. So what will happen? Hissing sound in right ear. Okay. Testlessness of right side of big meningioma. So there is a that destroy the surrounding tissue. So testless right side tongue, hissing sound, paralysis of right side face, and twitching of muscles. See the CT scan. See below what is written there. Dural based enhancing mass lesion in right temporal lobe meningioma in bulk and extent as described. Description of how it is like this. Coming to the see, it is here. This one you see, these are all meningiomas in CT scan. It is observed, do you think? These are the, this is meningioma. This is meningioma, likewise. Then doctors advise him, CT scan is not enough, go for MRI. The same lady has gone to MRI and the same thing comes, lobulated mass enhancing mass noted over the right side petrous bone and extension to right internal auditory canal. It was meningioma. See here, MRI report. In the 5th line, you see very clear part meningioma. If you read, please always see the reports of the patients. They will have confidence. Yes, doctor could read, homeopathy doctor could read my MRI report. So please see the reports always in front of the patients to get their confidence. These are the MRI reports. See the patient. She is completely, right side face is completely paralyzed. Face drawn to left. See, yes or no? Yes, sir. So, completely right side face, very desperate look, very sound looks up. I'm going to die and have a next operation. They are not giving guarantee that I will cure, and after operation, my deafness will be increased, and that will not be survived to try. So it gives me good chance to see. I also discuss you are not all knowing, all good doctors. So a diagnosed case of petrous meningioma, both symptomatologically and both radiologically. Yes or no? Yes, sir. So now my part comes. So I go on interviewing the patient. Anxiety, she told that she is a teacher. She told I have tremendous anxiety and I am not so active. I am sluggish mentally, physically. I'm introvert. Though I'm a teacher, I'm introvert, and there is psychotic trait, jealousness, hatredness, rough behavior. Though he's a teacher, rough behavior, and profuse persuasion in hours and prepared. My phone karte. So particulars, twitching of facial muscles, paralysis of facial muscles, right-sided, hissing sound in ear, numbness of face. So I reporterize taking this symptom, this, and Kalkiraka comes in first grade. So looking to the sluggishness, we all know Kalkiraka. What is symptom? Frustration, confused, almost unbuilt, desire, ache, sluggish, obstinance, anxious about contact, remember your body, and anxious on contagious disease, anxious, preference about very anxious lady, sluggish lady, not active, healthier child, timid child. Yes or no? Unlike chloroquine, unlike sulfur, unlike phosphorus, Kalkiraka, Varataka, and timid sluggish. Yes or no? Yes. So they are directly a case of Kalkiraka, and I have given Kalkiraka in the LM potence 2357. The first visit and second visit is reported that there is some improvement in the facial paralysis. So I went on giving LM potence. LM potence has a merit in the chronic disease that you can even take. Suppose you give it Kalkiraka 1 and 2, 1 and 4. Wait for 15 days to see the effect. But if you do the LM potency, you can do it daily or alternate the night. So I went and given LM potency. On 7th to 9th visit, it became stopped, it became static, no improvement further. So I went cancer cases, 3 months conditions to 3 month cases, EPD becomes static. You have look at the case, against evaluation, second prescription, and you have if the same symptom persisting, go for higher. If symptom changes, change the medicine. Go to nodule, go to the complementary. Yes or no? So the because same symptom persisting, I go to direct to therapy. But then no improvement. So no improvement. Patient told her, I tell you, you have much confidence in the good doctor, but 20% improve. When you say about but this numbness is there, twitching is there, IOP is not there. So because there is a prominent numbness, but what is the drug for twitching of facial muscles? The twitching of migraine. You must know in this or no? Agar it was migraine and the drugs for twitching of the migraine is very good drug. What for acute cases? What for acute cases? Okay, so that's what I give migraine, but no effect because migraine is not a so deep acting drug. Then visit, I gave Pasticum. Why Pasticum? Pasticum, there is no socks, no more sweating. Yes or no? Pasticum, aversion sweat. Is that salt? Sympathetic lady. Yes or no? So why I give Pasticum? Alan's very good students are there, very good teachers are there. Alan's in the whole Alan's there one that when improvement becomes static, where the improvement becomes static, if you can remember Alan's keynote, if improvement is static, in general you get Pasticum. If the improvement is static, in nervous system cases, give Valeriana. In chronic diseases, when the improvement, when indicated drug fails, go for Soridol. In acute diseases, when indicated drug fails, go for good, very good. Okay, so in respiratory cases, when improvement becomes static, go for Laura Serrasus. Alan's keynote. I'm not taking good books. When improvement becomes static, giving medicine, same symptom persisting, improvement is static. In general, go for Pasticum. Alan's keynote helps a lot. Same symptom, giving same medicine, then in between nothing happens. Even intercurrent antipsychotic. So Pasticum in intercurrent antipsychotic, given in hypotension. Opium is something, yes, opium and stramonium. In those cases, when main symptom is when there is a complaint, but patient has no pain, no complaint. He is suffering, but no, I am not present. And opium also is a good intercurrent medicine. In case of comatose conditions. Sorinum, tuberculinum, lastly I will tell you all these drugs. So, indicated drug fails, marginatic obstacle. So, now, there is a history of tuberculosis in the family, asthma in the family. Patient is psychotic. Why I have not given tuberculosis custody? There is a strong history of tuberculosis in the family. Okay, history of asthma in the family. The case is tubercular myasthenia. Why I am not given tuberculosis? Which is correct? We should give perspiration profuse, abortion weight, sluggish lady, indicating calculator. Past history, family history indicates tuberculosis. What we give? There is a problem in homeopathy doctor. Somebody no, strong tubercular history, give tubercular. Some don't know. So what is we give? Calculator. Why? Because now the indication, now the totality indicates what? If calculator not improved, there is an obstacle, remove obstacle. So now time comes for growth. So this helps you. There is a many times process comes. Sir, after falling, the tremendous backache, and my backache is more when I'm sitting. Okay, so after backache while sitting, drugs are Alan's keynote, Porcetilla, Covaltum, Rostrox, Zinc. Yes or no? Backache while sitting, drugs are Covaltum, Porcetilla, Rostrox, Zinc. Keep Alan's keynote with the fingertips to have good practice. Okay, so when the case comes to you with the backache after falling backache started, you give or you give Covaltum. Covaltum means aggravation sitting, because that's a backache after injury, which will be given. Overcome. Why? Now the symptom indicates towards overcome. Though history is there, overcome, not Uta. If Uta symptom cause injury, that will be. But Uta symptom is not there now. So tuberculin I have given as intercurrent because of history of tuberculosis. See the case. It is partially improved. Still there is paralysis, but able to look to, not clear, look to her face, able to speak. While speaking, mouth is not right to one side, no headache, but she is telling I'm much better, 50% better, but still twitching, tasteless tongue, tinnitus is persistent. All these things improve. Why? Twitching is not going. So let us again see. Tuberculum 10M, next visit, and after 10M, first 1M, then 10M, first 1M, then partial improvement, then 10M. So I send her. I'm actually, it is a bad luck loss that patients are improving if they go for a repeat follow-ups, they will not. Well, one minute, they will not discuss. I told that you will write up in this. Go and have again CT. So she went for a CT and see normal. The meningioma subsided. And you see the last, just to adjust, you see this, you just see the next report. See, this is the report, and see, now she is completely normal. See. How she came, the meningioma completely goes. So this is not a very big case, only symptoms are clear. So now she is completely cured, but disease are passed out, but tasteless tongue and anesthesia of the right side is completely damaged. The report this could not be recovered, it has gone. So you just try with physiotherapy, massage, etc. do and try to pull up. She is telling that only this thing is there. Okay, this is one case. Next comes to a case of meningioma. So my point is that, my dear friends, don't miss a case of meningioma. Lot of cases now coming to us. Don't miss a case. Just simply treat other chronic cases as you treated. Treat self. So the same next case of adenoma. I have to show you 4 cases. So I'm not going to just detail. Just you see here. Prolactin is you see here the microadenoma majors is a microadenoma. So this case was given third denum. I am not going to tell you third denum symptom. Just I will tell you what symptoms are that time. Very roughly, this behavior built from the breast, do not pregnant, do not winning time, and reacts with chili patient, obesity, tremendous headache, thyroid syndrome, thyroid syndrome. I have been thyroid on the basis of chili, reacts with rough behavior, and not responding to, I have given in anesthesia, not responding, and some of the drugs I have given not responding. So lastly, administration of thyroid, hypothyroid, thyroid given, and you see the next report. And just in the last, I will just want to see you for your confidence. See, this was referred by me. Last question referred by me. To bring your confidence, other reports was not by the other surgeons. This case of issue report doctor and then other. Okay, so this was report means others you see other doctors. Here also the same thing. So next we'll go to another. You see, after giving thyroidinum, but remember, meningioma case took me 2 years. 2 years. Patient has to be time we have developed this. This case also take 1 year, 272, prolactin is 0.7 and the pituitary got 39. Then comes to another case, pre-malignant tumors. So I have shown you 2 cases of benign tumors. One is pituitary adenoma, other is. So next, coming to a pre-malignant case, a person comes to me with a small swelling lump in the right submandibular gland. It is very hard, even to a surgeon, and symptoms are a firm, hard, wide-ended swelling in the right side submandibular region, along with a small lymph node in the cervical region. Please interact with me. Any doubt, or if any doubt with any report, please interact with me. Diagnosis by a surgeon: pleomorphic salivary adenoma of submandibular salivary gland. See, this is the gland here, small gland, but very firm. Have you seen here? Are you observing the gland here? Okay. So, as you know, parotid chances of malignancy is 10%. You know what? Parotid gland chances of prostate is 10%. Submandibular is 50%. Sublingual 85%. Parotid is common. Yes or no? Mumps, very common. Submandibular, uncommon. Sublingual, very rare. But you see the chances of malignancy. So, seeing the submandibular gland, the surgeon tell him immediately go for a FNAC. So, because it's potentially malignant nature, surgeon advises FNAC. See the report. Just to see microscopic report. I recommend to be a good practitioner, always see the report and discuss the patient. The patient has confidence in his doctor is doing biopsy, doctor doing MRI, doctor CT scan, you will develop confidence on you. So after seeing this, see the reports here, elevated nuclei, microscopy, some showing abnormal nuclei, some showing nuclear group, cyst marking. So abnormal nuclear group and capillary pattern is the biopsy. This is chances of malignancy. So they can make a possibility of capillary carcinoma cannot be ruled out. Who ruled? Who has done biopsy? That's the point. It has capillary details. So possibility of capillary carcinoma cannot be ruled out. So go for operation. Surgeon told there is chances of cancer. You go and quickly operate for this. He is a very poor person, and he told that I cannot afford. I came to you. If you can save me, save, or I will die. I can't afford now. 15. They charge 35,000 rupees, and he is a very poor person. Peon in somewhere. So peon and unable to serve his family. So symptom: hard swelling in submandibular region, increasing gradually, mild pain when exposed to cold and damp weather. Pain aggravates at evening, lying on, mind the symptoms, I will ask to the drop. At evening, lying on left side, aggravation after sleep in afternoon, weakness plus, and there is a hard indurated testis since last 2 years. These are sweet, salt, onion, intolerance, fatty food, offensive sweat, heat intolerance. Past history: recurrent chronic orchitis leading to testis hardness, history of vaccination, history of chickenpox, family history: mother fibroadenoma breast, sister uterine fibroid, father tuberculosis, last died of cancer lungs. So very bad psychotic history. Mental symptom: irritable, ill-humored, argumentative, sluggish, hurried, talks hastily, sallows words while taking interview, very quickly telling sallows words, mixing nature. He was a very mixing nature, but after diagnosis, now he is isolated in his room, not talking to anybody. His son reported that not coming out of the room, not attending office, though not so weak, causing a financial burden to family. Mental symptom: on repeated asking, why don't you come from your room? He told that I have diagnosed that cancer, I will die, so I said come out. And So he's in fear, and from his salary, he is managing family, but now not going to office, thinking I will die. Why go to office? So isolated himself in a room, not going to office, not getting the salary in the family job. This is the important point. I am telling you, to cure any case of malignancy, you have to depend upon these when cold aggravation, when touching aggravation, when eating aggravation has broken. You have to see life history, life situation, how it develops, what is the miasmatic mapping, what is the constitutional mapping, what is the strong etiology behind this. If you look towards the right side, cold aggravation, desires for the maternal or Malgraka is not help. So go to depth, and most important is how it happened, how it happened. So, the important point is that he is now isolated in a room, not going to office. And he feels that doctors are advised to die. I am also feeling that spirits are moving in the delusion state. Spirits are in my room to take my soul. Very peculiar. See here. This is in a repertory. Analysis of the case, delusion, someone behind him, because of persistent belief he will die, another person in the room, sluggish, dull, argumentative, quarrelsome, irritable, ill-humored, hurried, talks hastily, walks in the room restlessly. Like asking Alma, walks in the room in repeating circles. Analysis of the case, desire salt, sweet onion, intolerance to fatty food, pain in gland, aggravation by cold, indulgence of glands, both salivary and testis, on hypothyroidism. Rubrics are what I have told you. Strepsiagia, thuja, silesia, sulfur, phosphorus. Okay. So what do you like to give? Hasty, quarrelsome, argumentative, bad nature, selfish, not suffering of cancer, thinking of cancer, isolated, not supporting family, but in the job. The worst personality, the most selfish personality, the most argumentative, the nasty person. Why? Psychotic. Psychotics are the worst person in the world. They don't believe anybody. They don't like anybody. They want to pull the leg of the others. Very bad. So I want to see. But I gave importance to always in your practice, do you give importance to delusions? This is my totality, you see, not visible to you. In my totality, I gave importance to methods from past. If any delusion is there, I will depend on that. I will not go purpose. Do you get any symptoms of delusion in practice?
What importance? We get it.
Very good. But many of the young doctors, patient is telling delusion symptom, they could not catch because they do not know. And if you know, it gets go to delusion in the mind section. Delusion covers highest stages. Yes or no?
Yes, sir.
Why? Important. Prescription depends on delusion. So what is delusion? So in my practice, I give first delusion, then etiology, then mind, will, intellect, memory, then physical agenda, last particular, with the basis of past history, families, argumentations. Yes or no? Will you follow this? So this is, I first see delusion with that. Next I will confront etiology. Then in the mind sphere, first will. Why will intellect and understanding? Which is very important? Will. What is will? And tell me will symptom. Pardon? What is it? Will symptom. Sir, I don't want to believe. I lost myself. When there is tendency, I don't want to believe. I lost everything. My willpower eroded. My willpower destroyed. I want to be committing suicide. I am depressed. I am enjoying the world. Hello, right? So this is will symptom. So suicidal tendency is the most important symptom because we like
concepts. When you write to destroy ourselves, that is our will is damaged, will is eroded, will has destroyed. So will is then comes intellect, memory. We are asking, are you irritable? Are you forgetful? Then intellect, then memory. And you see particulars in my hierarchy of evaluation, particulars are in the which rank? Lowest rank. Lowest rank is particulars. With a cleavage of mathematics and families. So I hunt for the will that other persons in the room. What is the dog? What to say? So let us. Pardon? Very good, very good. It's a good point. But this is in the italics. But the first grade drugs I'll tell you. So, what is delusion? What is delusion? The intense, exaggerate feeling of a normal fact. What is this? Intense, exaggerate feeling of a normal fact, which becomes dominant and fixed in person's mind. Understand? I'll give an example. Just try to remember. Intense, exaggerate feeling of a normal thing in the family, but becomes stuck in the mind, and that becomes that makes it to act like that way. As example, a patient comes to me 3 months back, father of an IS officer. His first son is IS, second son is an engineer. Both the sons know the father. I asked, what is that? He's 89 years old. I have had a complaint. They can, what was the complaint of that father? Prostate is enlarged, urination is incontinence, they came, sons came for him. So I asked, he said, what do you complain? What is silent. So I told his sons to please wait in the outside, I am asking him. So I said, I am neglected. I am neglected now. After retirement, I have no earning. So my children are neglected. This is his complaint. He is old, heart complaint, urine complaint, passing urine in the bed. What is his complaint? I am neglected. So when I called their son, what is happening? After coming from office, both the sons went to his room, asked, what is happening to you? See TV, we gossip with two eyes officer, but I am giving 1 hour daily to him. The engineers are also giving in the morning. So I will never do it. But what is it? This is delusion. Because I am retired, because I have no earning, now I am useless to the family. So I am being neglected. This is a wish belief. So to say, not happening of the day-to-day life of a person. So if I am one person, if my willpower is strong, and if suppose my son had told something, I take it lightly. I will not take it that I am neglected. If my vital force is strong, if vital force is weak, if somebody told me something, if it not telling, I feel that I am old, so the vital force strong can overcome the delusions. Vital force is weak, that will allow delusions to be in the mind. Are you following me? And becomes depressed, becomes irritable. But that is stock up in the mind. Common happening, stock up in mind, and act according to that. See, by the time of childhood, where delusion, I see glimpse of walking on the knee. What is this? By the time of child is stream is always I'm walking on the knees. What is that? Because he is dwarf, so he dreams that I'm walking on the knees. Ultimately, under delusion, my life is useless. Nothing good happens to me. Though he is keeping fast and good officer, everything, but has a delusion that because he is nervous, ultimately nervous or strong, nervous, because nervous. So there is always a feeling that nothing good happens to me. I could have done better. Delusion. Okay, so delusion is a sick mentality. So, looking to the reported chart, there is Tapsagia, Thuja, Silesia, all have same delusion. Delusion of someone behind him, drugs as Tapsagia, Thuja, Silesia, Lachesis, Belladonna, Alancarium likewise. So how to differentiate?
Can you tell me the why there's a feeling of someone in the room in Tuja, in Bantaka, in Kalkara, in Subsecretary, in Science, why? Those same religion, someone here, another man in my room, same religion, nobody there, but patient has religion there, somebody else in the room. Why? Can you tell me? What is there? You see, you have to be a good practitioner, you have to go to the depth. Staphylococcus is mental symptom, highly conscious of his dignity and prestige. Yes or no? You don't want to see a close face. Somebody I am talking to somebody dozing, somebody so disturbance and cancer. Because the close face means I became upset, I lose my interest to speak. The close face, angry face. So Staphylococcus is so sensitive and so conscious of his dignity and prestige. You know, very conscious of it. Please go to the depth of the athleticism. Why there is a delusion which somebody else in the room? Because he is so conscious of his dignity. He always feels, am I thinking wrong? Will you be observing me and writing wrong? So this is delusion that why I am doing what? And if I do certain little mistake, somebody there to see me. So he is always looks here and there. Anybody else in the room to see his mistake? By who is his dignity, prestige, good. Understand my point? Try to understand. Many persons are just try to follow. In Silesia, so Staphylococcus delusion of someone else in the room is because he feels that my mistake can be caught by another person, keep observing me, being present in the room. So he will be given there, somebody else in the room. Silesia, fixed idea. Silesia, fixed idea, you know? What is Silesia, fixed idea? We are reading in the book Silesia, what is the meaning of this? Silesia like Staphylococcus. Silesia like Staphylococcus. I am going to death from that class. When I go to death, that's why you want to say, don't go to death. So I am going to death, but it is not that. I am observing many persons who don't tell that. That is very different type level of audience in that. I just very much to on. Okay, so I'm just passing on to the little superficial things. In Silesia, what is happening? Like Staphylococcus, he's conscious for his dignity. Silesia fixed area is, see, so what is meaning of Silesia fixed area? I'm just trying to make you understand. Staphylococcus, Silesia, both are conscious of dignity, both are conscious of prestige. Staphylococcus wants ornamental, conscious of prestige and dignity. Yes or no? Ornament Staphylococcus wants to be best in all spheres, in study, in debate. Student of Staphylococcus, he wants to be appreciated others. Yes, good player, good student, good debater, good speaker. Okay, this is ornament Staphylococcus. Silesia has a fixed idea. No, I will be engineer. So he will be happy. He will be good in mathematics. He will be happy. He will be happy. Never as engineer, not like this. Study fixed idea to be a very good man in that sphere, that fixed thing. So for his fixed idea, for his dignity, he looks here and there. Anybody looking for God. Then coming to Kalkira can be easy to follow. Kalkira has a tremendous fear of ghosts. So when alone this color ghost is there, this is easy to follow. Yes or no? Kalkira fear of bleeding, fear of suffering, fear of surgery, fear of disease, fear of discovery, fear of ghosts. Yes or no? So because there is a fear of ghosts, the ghost is there. Similarly, coming to anacardium, why anacardium has got this secret training, anacardium has a government training. Why? You know, carcinosin anacardium and carcinosin both have a strong parental control. Carcinosin and anacardium. In the childhood, no, you can't go to play. You have to sit here. You have to wait 8 hours. Parental control sleep. So carcinosin become better. Anacardium will go up to 15 years obeying the parents. After 15 years, will become
very hard and 50 years you have told me enough. Now I am going to do things in my own way. I will do it. Becomes antisocial, hard. But sometimes he thought, sometimes good, sometimes bad. Demon and devil. So, because of this dual mentality, there is sometime feeling of another person in the room. So let us pass. So in the chart, there is Tapsagia, Thuja, Silesia, sulfur, lachesis, phosphorus, all of them. So lachesis could have been thought for this case, but lachesis, the lesion is there, but as you know, lachesis is loquacious, yes or no? Lachesis is joking personality, yes or no? Lachesis is demagogious, joking, sarcastic, enjoying personality, loquacity, sexy. Lachesis is all good qualities. Talkative, sexy, jovial. Okay, so this is the man after the slightest of in the room, not talking. Lachesis cannot give. I am discussing that person's mentality. Medrinum, the same delusion is there, someone behind him, but Medrinum is hurried, sensitive to reprimand, anxiety of conscience. These three things are not in the person, so Medrinum is excluded. So while seeing the chart, try to exclude one by one from which not least. So Thuja having fixed idea of somebody else. Why Thuja have a fixed idea? Thuja always have an idea that fragility feeling. I have cancer, so I will die. Fragility means break down. I have cancer, so I will break down. I will die. So because of death, is that he feels that my death is approaching. Spirits are the so hurry, hasty, quarrelsome, very bad personality, neglecting family for no cause. So I gave him Thuja. To summarize, Stapsega delusion, just remember, Stapsega delusion due to conscious of towards others feeling. Silesia for the conscious of fixed idea. Kalkiraka delusion of some other spirit in the room because of fear of ghosts. Anacadium delusion of somebody else in the room because of dual mentality. Thuja delusion, somebody else in the room because of dominant fixed idea. I am a fragile person. My limbs are made up of glass and would break easily. Thuja. So I gave him family history, fibroadenoma, carcinoma, vaccination. So Thuja is given in higher potency. Okay, partial. So I'm passing quickly. Thuja is given millisima LM, then CM. After giving Thuja CM, the swelling becomes painless, swelling static, but size not improved. So he again went for the examination, and this time, this is I have referred to. This time I referred for the biopsy because it is painless. I referred, but there the pathology is correlated. You are taking whatever to die. What is the report? Now worse than before. See, worse than before. The same things are there. He misguided him. Biopsy is strongly suggested to differentiate metastasis, pathologic carcinoma, or salivary biopsy. Again, the same nuclear group, nuclear cyst, papillary pattern of elongated papillary pattern. So the patella owner will come me, why do you put this patient in your hand? You may face sometimes a court case, consumer court case that you are treating these persons this 1 year, only 1 year past. And you are not referring him. I told him I need to go and have a surgery, but he not going what to do. Then he told right every time advice for surgery. But then you will drag him to the court. Or you will go to court, consumer's court, you will find you have neglected patient, and the patient of pre-malignancy condition passes to malignancy, and you have to pay lakhs. So I told the same thing to the patient. The patient told, sir, you treat, I am making right. If you die, you move. I am listening. So again, I told you, I took another chance of him. So I have told you that my treatment is delusion, metastasis of face, I go for it. In your practice, I am advising you that while a case fails, Ask him, take 15 minutes or half an hour, how it happens. Then tell him, we are leading a good life. What makes you to fight this disease? So many persons will tell, sir, I am being frustrated in my love affair. After that, I became depressed, then blood pressure, then sick. So you have to see what are the elements from it, and from that you have to treat that what I talked about elements of the Homoeopathic, Posticum, Magnesium, Natrium, Silicos, Subsidiary, aspect. Elements from G. Okay, so you have to take. So I see to the patient and ask, "Bhai, tell me if you want to give me a chance to take. So you show me how it happened." So he, by the way, he told that, sir, I was right. Gouri sea beach have a Odisha, Gouri sea beach. Don't have very good sea beach, better than any sea beach of Kerala. Okay, so I happened to Gouri sea beach. Had a sea bathing there, came with the heat of sun. Then I got cold. It started. I got the cold. See, when delusion, mental symptom fails, go on, it will be practice. So I took up that point. Delusion, etiology have taken. Then, so emphasis was given to delusion. Now it is, I just ignore. Taking the follow-up that the complaint starts after sea bath and exposure to heat. And see, delusion, people behind him, aggravation after sea bathing, aggravation after sun exposure, took up the case, bromium comes. Given bromium, you see. So see, sea bathing exposed to it, 4 drugs are there: bromium, magnesium, natrium, bedroinum, arsenical, etc. So natrium could have been thought for this case because sea bathing is there in natrium, yes or no? Exposed to natrium, but the peculiar delusion that someone else in the room is not there. So excluded, there is not there. Similarly, what is the symptom? Carcinosin could have been thought of when there is an obstacle while treating cancer cases, ignorant cases, think of carcinosin. But what is carcinosin symptom? You can tell me 3 or 4 words. Carcinosin, don't give carcinosin empirically to any cancer patient. Don't give to any pre-Malignant conditions. Don't give what is symptom? Carcinosin.
Family history of cancer.
Pardon?
Family history of cancer.
That's good. He is very correct that carcinosin should be thought of family history of cancer than pre-cancer patient. Unless you know. That's not the point. I'm asking mental symptom. Similar. Cancer. See, remember, see, you can see cancer patients in cancer. Tendency to perform all things exceedingly well. Carcinosin is a very good thing. Wants to do things exceedingly well. Okay, superhuman put to survive. Those he is suffering from cancer. Those suffering from cancer has tremendous desire to live and to cure. Will go here and there, treat, yes, I will cure. And moreover, another point is put control over ourselves. Those suffering from cancer, we need perfect. During cancer stage, good father, good friend, good mother, suffering from cancer mother. So don't think cancer is good. Cancer is always persistent on his work and good behavior and strong desire to survive even if suffering from cancer. The person is frustrated all the time. So this person has no desire to live. So carcinosin is excluded. Arsenic, you know. So Conaim, another drug nearer to bromium. Why? Conaim has delusion of someone behind him, hard gland, but Conaim lacks the symptom of aggravation after sea bath, aggravation or sun exposure. So bromium is the drug, come for choice, covering almost all symptoms. Bromium is given, okay, and bromium in 200, 1M, 10M, and you see, bromium, the size come down to 50%, but again, when he exposes to cold, it is again increased. So tuberculum 10M was given, 10M. Then after giving tuberculum, ringworm was there. He applied topical applications. The skin eruptions come out. Sonia is giving C. While treating a pre-malignant cancer patient, zigzag way of treatment. Sorimazum, cyclomazum, cipitimazum, again sorimazum. You have a zigzag way of treatment, not a straight course. Cannot be in one drug. So, chromium exposed to cold, ignorance, kilochroma, after kilochroma, again combined of sodium. So, like a zigzag way of treatment, and you see now he's better, tumor subsides. So I advise go to the same pathologist and bring the report. See, I have advised here, and you see the report. No cancer cells, no atopic cells, no papillary nuclear. See, cytomorphic, suggestion of chronic cyanoadenitis, cystic disease. No papillary pattern of cells, no nuclear group. And the same pathologist for me is I will have same pathologist, very big pathologist. They told me from inside, I have scolded it. Now I am ordered to take that is good and who is said switch for. So see, but having 3 years passed. 3 years, patient is nobody can remain. Had it been a rich patient, you could have go for operation and would have suffered. No success. Because he is a poor person, gives chance to me 3 years. Next case. So this is the case we see. You see his swelling is completely gone. See his video. He's telling in Odia. He's telling I am fine, no swelling, no pain, no tenderness. Leave it. The Odia language. Then it is in Hindi speaking. He is a Hindi fellow. Just put on mic. Time. Leave it, surely. So, following Hahnemann classical homeopathy, cure of pre-malignant concern. Another case you see, CIN1. Very quickly I'm passing. Because audience becomes bored after 40 minutes exposure to speaker. Only 40 minutes. So now I get bored. So let me quickly pass out. Swing the cases. CIN, cervical interepithelial neoplasia, a potential malignancy condition of cancer cervix. So, a patient complains of irregular bleeding, blood stain, white discharge since 6 months, offensive discharge, house-bearing discharge, examination for one specialist, cervix, severity, hemorrhagic, irregular, erosion, diagnosis, erosion of cervix or neoplastic changes. The advice for see this plastic changes is quite ubiquitous, touching half chicken epithelium in some places. That is ulceration in this plastic cells. If I observe, I see medical college. So CIN1, he wrote it and microslides are attached. Okay, she came to me. So case study, menses irregular, deep cracks in centers of tongue, words, diarrhea tendency, desire salt, butter, fat, fried, spicy food, aversion sweet. Patient is chilly patient, thin, dark complexion, life situation. The lady is 31, 32 years old, and told that I have an affair with a boy and we lived for 3-4 years, but he cheated me, married somewhere else, and after that I became frustrated. My parents gave me marriage in some other place. I am married, but I am not happy with my life. Okay, and I have no children, and I am suffering from this. So, frustrated life situation. This is the life situation. I am again telling you, etiology, life situation is very important for treating cancer cases. Okay. So, after the boy cheated me, I am also equally vindictive. I wanted to go to my boyfriend's house tell her wife she loved me for 5 years, frustrated me, and she wanted to take it. So a revengeful lady, a very merciless, revengeful lady. Okay, so vindictive, revengeful mood when cheated, and she tremendous anxiety because she knows that pap smear is positive CIN1, Z1, so she is very anxious and during interview constantly asking, am I careful or not? As the gynecologist advised me for surgery, if delayed, will it not turn to cancer, doctor? Very, very badly he asked me. I told her I cannot say. If you want to be treated, don't tell your patients that yes, you are going to treat. They will record and make a sue, make a court case against you. Okay, so very tremendous anxiety to be for the recovery. He is a suspicious lady. Company aversion to silent. What is the drop coming to in your mind? Vindictive, tremendous vindictive, and anxiety. Very good. Very good. Thank you, doctor. Only the drug, vindictiveness, obstinacy, rogue lady, triple plus, naturalism, anxiety, morbid fear of cholera. Remember, Allen's keynote, nitric acid, that you want morbid fear of cholera. Why? Why morbid fear of cholera? Why? Animals time, cholera is not curable. Right now, cancer rates. So in animals time, cholera is incurable. So animal wrote that morbid fear of cholera. I didn't know that we have to take administrative processes. We have replaced that thought. Now, in nitric acid, morbid fear of cancer. We have changed cholera because they are not fear of cholera now. Now fear of cancer, AIDS, HIV. So we have replaced that one. We have to town center, we have replaced that one. Morbid fear of cholera, morbid fear of cancer. Replaced. Okay. So sympathetic. See, nitric acid, vindictive, anxious, sympathetic. As who is the other sympathetic persons? Phosphorus. Nitric acid. Can you tell me the sympathetic of phosphorus? See, I'm telling you. Phosphorus sympathetic is friendly. Sympathetic is actually there is human sympathetic. The nitric acid sympathetic is selfish sympathetic. Whenever he is in good motive, he is sympathetic. Once you call something against him, he is sympathetic as God. So, purposeful, selfish sympathetic is nitric acid. Purposeless, selfish sympathetic is phosphorus and phosphorus. Again, phosphorus first comes sympathetic. Phosphorus is 12 pm sympathetic. First comes is 3 pm sympathetic. Drug given. What and what is there to differentiate drugs? So, nitric acid was given. These are the phosphor. How differentiate? I am just to. Sulfur also comes. So how sulfur can be different? What is the sulfur and nitric acid similarity? Sulfur also, when humiliated, will take revenge. Okay, sulfur. Nitric also same. Okay. Sulfur also went to the inner house where he loves me. Nitric also same. How to differentiate? Sulfur will persuade how to break my mind and nitric will come out. Scolding will come out. It's very good difference there. Elements from things when embarrassment is there, he will try to overcome embarrassment and struggle to come up from embarrassment. Others will fail. A good difference in mental sphere to catch up these cases. Mercury also the same, very hurry, hasty, quarrelsome, everything there like nitric acid. So directly coming to case, after giving nitric acid, you see this doctor is very adamant. After seeing the yes put at this report, he does not like to write my name. See, whoever the doctor will cure pre-malignant cases. So he told that report was wrong. I will try. So, but You get the report, severe inflammatory changes. Type of hypertension, okay, so I am beginning that again there is from pre-malignancy to advanced. So this case is completely cured, and but his nature, vindictive anxiety is still persisting. Okay. So last case, this is a malignant case. Very interesting case. Takes 9 years to be cured. He has patients, I have patients, I have 9 years. 9 years, you're completely cancer. I'm passing very quickly. An early diagnosed case of cancer, gallbladder, agonizing pain, right hypochondrium, as he died, serious care. Sir, do something, I will die. Serious. As he dying, can edit it to back, then aggravates in morning, evening, slightest touch, then aggravates after constipation, then accompanied the hot feeling of abdomen. Palpable mass in right hypochondrium. So history of patient complaint. There was gallstone. For 5 years he suffered. After 5 years, gallstone, you all know in surgery, gallstone remaining for 5 years may turn to malignancy. Yes or no? Gallstone don't treat after 2-3 years. But turn to malignancy. Don't try for gallstone more than 1 year. May turn to malignancy. So the same thing happened here. So see the case. I have not report from certain report. Then the surgeon told him, I cannot believe ultrasound, go for a CT scan. See CT scan report. Findings are suggestive of presence of enhancing GB mass region, pressure. 50 centimeter to the intra pressure, GB mass is there, and targets for FNAC. In FNAC, you see metastatic adenocarcinoma. So he again the lady went to a surgeon. They advised severe reaction, could not sustain. The boy, the son, they brought to me, said, do something. Early stage, can you help me? So I took up the case. So this is the lady. See the agonizing pain, quick passing. So during interview, very alert, quick in answering, mark the words. Cancer suffering, but alert, quick in answering, talks elaborately and correctly, unless stopped and talking, talkative nature. Irritable to slightest contradiction, vivacious, talkative, dominating, anxiety in crowd, miser lady, not at all tense, those know suffering from cancer, normal mood, those knowing that cancer is there, vivacious mood, those knowing that cancer is there, jovial, well-settled life, children well-settled, husband died suddenly due to road accident. She was with a gallbladder pulling well. Husband died with road accident. After that, after a week, tremendous pain started. She undergone these investigations and found the diagnosis of gallbladder mass. So portraits elements from mental shock, cheerful during interview, mentally, physically very active, loquacious, dominating, vivacious, anxiety in crowd. What is the drug? Loquacious, vivacious, talkative. Those suffering from cancer, not jovial, loquacious, talkative. Okay. So lachesis also comes in these are sweet pickle. So on this sulfur arsenic lachesis comes on in the repertory, but though because it is a psychotic dominant, exclude sulfur, though
as the lady has no anxiety, I exclude arsenic. Yes or no? Can you think of arsenic in a patient without anxiety? Arsenic excluded. So because of both jovial, talkative, lachesis is given. Okay. Lachesis, see, again millisimal, some improvement is there. With lachesis 10 some improvement there. I have told you, lady is a very miser fellow, not likes to spend money for the treatment. So left treatment. After 3-4 years, he came with severe pain, and this time symptom changes. Lot of flatulency, pain aggravates in the afternoon. Lot of changes, and lycopodium is the complementary to lachesis. Yes or no? So afternoon aggravation, flatulency, and miserness. Looking to these points, I gave lycopodium. Next concept, lycopodium 1M. No improvement. Patient comes with severe intolerable pain, right hypochondrium, and this time pain extends to that. So, despite the so what is the medicine? Very the right extends to that. The body. Lycopodium children, more or less same. Only lycopodium occurs in the afternoon, afternoon, morning, both. Or more in morning. Okay, children 10 given, no effect. So, as you know, when it drop fails, first is on lower cells, valerian, sodium, sulfur, but in other cases, when 3 drops indicated in a case, 3 drops, all have indications. Selenium right side, lycopodium afternoon, lachesis and metalsin. All 3 drops symptoms dominated one test. What will you do? Think of this. Think of brochure. And brochure is covering all these areas. But tell me any brochure covering the aspects. Because yes, afternoon, refer to that. No. So when brochure is not actually think of power brochure. I mean, I can power brochure, more than pure, psycho, proteus, any idea? Proteus, I am telling you, proteus is a drop, you can give guaranteed PID. PID with numbness of feet, give proteus will be guaranteed. What is the symptom in Raphael? Turning lumbago, sciatica, numbness. Raphael, yes or no? So when Raphael fails, think of proteus. Okay, so lycopodium, chelidonium, and lachesis. All are in one drug, luckily, that is Morgan Gardner. First, go and turn over your pages and Morgan Gardner, co-lateral associate remedies are chelidonium, lycopodium, lachesis. And Morgan Gardner is given. Symptom subsides, lady is better. So I advise to go for a ultrasound. Ultrasound appearance of the abdomen and there is consistent chronic cholecystitis. I've told you the patient passes from gallbladder stone to gallbladder mass. Now you see after Morgan Gardner, so long, 200, 110 years after 9 years. After now the pathology was I astonished and that so when that doctor I telephoned him that he was having cancer now no cancer I wish him correctly. That's how you are morphing. We cannot cure cancer. We are morphing. We will show these reports and these reports are all. See our fate or see our fate. After so many reports, when ultrasound, FNS, so many reports established as cancer, taken radiation, but when Morgan treated, it forgot about. This is our so develop our status.
developer status. We are caring, but not recognized in the society because we all are not up to the mark. Try. Okay, so then I add, with much curiosity, I advise go for FNSC. See, the same thing happened here. Smear shows plenty of acute inflammatory cells are mixed with acute established. No malignant destructive cells found in the smear signal. The same thing happened. Again, the lady left the treatment, knowing that cancer is not there. The lady left the treatment and again come after 1 or 2 years that pain is there. Why pain is there? Because of gallbladder stone. So Morgan Pure is the acute of sulfur 10 mg given. See, sulfur 10 mg is given, and lastly Morgan Pure 1 mg is given, and you see the reports. See how homeopathy can do magic. Sonography findings are consistent with cholecystitis, choledocholithiasis, without delay obstruction, women with poor delineation are outright, no definite calculosis. Now calculus is already explained to student without any delay obstruction. See how homeopathy does miracles, wonders, magics. But one case I am just showing you, not all cases. Now patient on sulfur surviving. So this is Herring's law of cure. Stone to mass, again mass to stone, and stone now going to be expelled. This is the video. Not. She is happy. She told that no pain. I am happy. I am laughing. Thanks to you. So now, to conclude, in scope of homeopathic tumors, in benign tumor cysts, I have told you meningioma, pseudopancreatic tumor, PCOS, uterine fibroid, micropituitary, and glioma at better scope. Glioma partially improved, of course, but others, meningioma, pancreatic, pseudopancreatic tumors, PCOS, uterine fibroid, good scope. In pre-malignant cases, CIN, salivary adenoma, leukoplakia reversible, CIN3 astrocytoma not improved, but shows marked improvement in the quality of life. Malignant cases, if early detected, scope to reverse pathology. Metastatic cases, prolongation of life with good quality of life. If surgery has taken, only quality of life can be improved by homeopathy. So how to approach? See, this is very important. If there is a mathematic bad background, if there is a persisting exciting cause, the constitution can passes to the abnormal state, vital force change, dynamic state of the state. As you all know that the disease is already inside the body, but no symptoms, only feeling of weight, feeling of malaise, etc. There is a pre-pathological dynamic state, and this state, if you go to allopathy, go to psychiatrist, nothing, you have stool normal, urine normal, blood normal, why are you just a complete where do we normal go to psychiatrist, psychological. But this is actually already is measurement. Pathological state, pre-pathological state already happened. They cannot catch. This is your time to reverse the patient to the normal. So, when there is a dynamic state or pre-pathological state, patient coming to you not feeling all right, basing upon no symptom, what will do? So you have to base a prescription on mathematic, mental state, physical general, everybody has desire aversion. Everybody has mental state. Everybody has some past history. Depending on these backgrounds, no abnormal pathological symptom already come out, nothing come out. But depending upon his past history, mathematic background, and I am doing computer work, so that is tremendous factor. So these predisposing factors or persisting factors we can prescribe. Yes or no?
Yes, sir.
Yes or no? Tell me.
Yes, sir.
Depending upon the dynamic state, depending upon the family history, past history, and dynamic mathematic. Suppose, tell me, there is an accident. There is an accident. What will happen to a spheric patient, spheric background patient, psychotic and psychic? That I know that mathematic background knowledge. Suppose there is accident. The person in the car is accident. And there is some issue with the field. What is spheric patient, spheric patient? What will do? What is psychic patient do? What is spheric patient do? See, spheric patient will run away. Accident. Then run away to hospital or house. Take me to doctor and accident. Why? Tremendous anxiety. Psychotic patient will drive the car, come home because he has courage. He has he's adventurous. He has capacity to take adventurous steps. Sympathetic state patient, though there is an injury, he will lag behind the person who made accident, caught him. Why? Because I will take revenge in this way. So likewise, from these habits, I got sleeping on the clinical application measure. On this, how a solid wears a dress. Solid wears a conservative dress, full dress. Psychotic wears a half swimming dress. And sympathetic wears a short swimming dress. So there is good practice. By seeing the patient, you can draw solid patient, psychotic patient, sympathetic patient. So from the pragmatic background and from the mental state, from the desired salt, aversion sweet, which is the drug? Desired aversion sweet, first you come phosphorus, lactinum, sulfur, mercury. Keep in mind all these things. So from this you can have a prescription, though no symptom available with the patient. Yes or no? So this is your blessing, this is a boon to you by hand that homeopathic doctors can prescribe in the pre-pathological state to reverse the pre-pathological state. Yes or no? Sir? Okay. But in allopaths are unfortunate, because unless tumor comes out, they cannot operate. Unless if tumor comes out, they will give chemotherapy and radiotherapy. They will wait after the tumor comes out. And when the tumor comes out, they will operate. Suppress psychotic pre-malignant tumor, they will operate. Suppress psychotic matter, which will bear a malignancy stage. So after pre-malignancy, unless given a suitable homeopathic drug, if operated, that will come to results. So we are fortunate in that respect. Okay. Psoriatic pre-malignant tumors, slow growing. Psychotic pre-malignant tumors, fast growing. Syphilitic pre-malignant tumors, rapidly ulcerating. Pre-malignant tumors indicates more than one active miasm, and hence requires to be treated as per direction in chronic disease. Pre-malignant state tumor, though expressed locally as benign, cannot be considered as local. Remember, hard mass calcarea floor, wrong. Soft mass lapis wrong. Parotid swollen, parotidum chromium, wrong. Do not treat as local. Again, go for the don't treat a tumor as local syndrome. Treat it as a whole. So, pre-malignant state tumor, though expressed locally as benign tumors, cannot be local. When removed by surgery, it causes suppression of psychotic miasm and hence accelerates the formation of cancer. In homeopathy, the benign pre-malignant tumors is treated like any other expression of a deeper generalized miasmatic state, which reverse pathology. Removal of nasal polyp, adenoid, moles leads to weak the immune system responsible for production of abnormal cell multiplication forming tumors. Causation, these three lines important. Causation, miasmatic state, emotional trauma are the hidden facts of genetic mapping. Do you understand this point? These two lines are very important. I am repeating again. Causation, miasmatic state, emotional trauma are the hidden treasure, hidden facts
for genetic mapping. When you come to the world, when you take birth, your miasm will come from causation, miasmatic inheritance, and emotional trauma during your childhood. That is the hidden treasure for your treatment. Hidden mapping, miasmatic mapping for your treatment. Homeopathic approach to cancer. Long again, I am just passing, showing the only drugs, only named drugs. I can discuss more. A lot of time passed. Proper homeopathy. See, homeopathy approach to cancer is different in different stages of cancer. Proper homeopathy treatment consists of general and local. General consists of constitutional cancer medicines based on when the constitutional symptoms are not available. So first is approach constitutional. If the patient passes to advanced pathology, then comes to the cancer medicines based on keynotes. Keynote on pain, keynote on pathological basis, and sometimes also you have to give organo-specific drugs. I will show you some organ. Tongue, gallium aperine. Suppose I will show you some cancer drugs likewise. And sometimes also you have to take the help of tautopathic drugs. I will show you. And sometimes nojodes and specific nojodes. So while treating constitutionally, emphasis will be given on totality, past history, family history, miasmatic history. So when there is no totality, no constituency, depend on keynote, organospecific, pathological basis, nojodes, isopathic nojodes, tautopathic drugs. You see how much fortunate you are, how much you have opportunity to treat pre-malignant, malignant states. Totality, if not totality, keynote, organ-specific, pathological, nojodes, isopathic nojodes, tautopathic drugs. Some examples: nojodes is carcinosin, scarinum, pancreatic cancer, pancancero, non-specific nojodes for cancer, sorinum, tuberculum, medurinum, Morgan-Gardner, and Proteus. Tautopathic drugs nowadays. Have you anybody practiced cisplatin? Cisplatin is a chemotherapy drug for allopathy. Now it is available in potency for cisplatin. These are the drugs from the chemo groups. Cisplatin, carboplatin, vasclafan, QC-phosphamide are now available in potency to treat cancers. So now this is important. You see in the repertory, if against a single rubric, one drug given, very important. So in the malignancy for astrocytoma, remember, very important drug I have often used in my practice. When I will not get a drug on constitutional basis, advanced state, no symptom, astrocytoma comes to me, plumbum iode. Symptom is associated with the gradual development of paralytic condition. Okay, astrocytoma, naphthoquinine to arrest rapid development of glioma. Valodorata, burning pain of fibroid uterus. They are single drugs against the rubric. Lapis salve with intense hemorrhage of uterine fibroid. Myoma, hard and large, calcarea floor. Tarantula hispanica is a drug. Very good. Remember when you are treating a case of any treatment of spinal column cancer, say neurofibromyalgia, spinal cord, severe pain, nothing active. That is single drug in the repertory. Tumor, spinal column, tarantula hispanica. When there is a tremendous pain in the spinal cord, due to cancer, due to neurofibroma, due to any growth, not responding to any treatment, there is no symptom. Tarantula hispanica 6. Will act like tarantula is a drug for the Chinese, against philosophy. Last chapter, the Chinese intelligence, dying, drug for dying patients. Drugs for, so it will not cure cancer, but the tremendous burning pain of spinal column due to tumor, cancer, is very much palliated by tarantula hispanica. This is my experience, lying practice. Any severe pain in spinal column due to growth, tarantula hispanica, single drug in the repertory. You go and verify. These drugs we must verify today in repertory. Plumbum iode, single drug for astrocytoma repertory. Naphthoquinine, single drug for glioma. Violadorata, single drug for burning pain in fibrouterus. They are all acting. Then some drugs, no time discussed. Sedum acri, scrofularium rhodosa, simple tectorium is a good drug for trunk cancer. Condurango is a drug for esophageal cancer. Cistus for glands. Hydrastis for carcinoma stomach. Symptoms are there. You'll see all the drugs. And organ specific, I told you, for lips, Condurango is when no totality, no constitutional drug. For lips cancer, Condurango, tongue cancer, Calis sinetum, Simperium tectorium, Gallium aperine. I am telling you in my experience, these drugs, Simperium tectorium, when there is a nodular appearance of the tongue, cancer tongue, nodular appearance, Gallium aperine. Go and online Gouri today. It will come across a lot of cancer tongue patients. And it is palliating or curative. So when there is ulceration, think of Simperium tectorium, the nodular tongue, Gallium. Pharynx, cistus, esophagus, Condurango, stomach, hydrastis, Condurango, pylorus and duodenum cancer, ornithogallum. Very good drug. Loss of appetite in the stomach cancer. Ornithogallum, they are not out of your terrible drugs and palliating, increasing the quality of life, increasing appetite, decreasing pain. So this ornithogallum is a very good drug for duodenal cancer, pylorus cancer, stomach cancer with loss of appetite. Okay. Similarly, Siccum, ornithogallum, sigmoid colon, scopularia, annus, Condurango, liver, cholesterol, pancreas, phosphorus. So likewise, see, almost for all homeopathy is blessed with specific drugs for cancer, for these things. But I have to again remind you, caution you that the pain, to palliate the pain of cancer, arsenic, nitric acid, apis, arnica, euphorbium is a very good drug for painkiller of cancer. Ruta is a drug for cancer rectum. Okay, pathological prescription, calciriflow, lapisal, ruta. So my conclusion is, if you are lucky, if you get a case of cancer in early stage, go consistently, have patience, follow consideration, follow second prescription, have ideal management cases, give confidence to patient, give consistent drugs, you will cure. Consistent drugs depending upon true totality, not this false totality, depending upon true totality, you will cure pre-malignant tumors, benign tumors, and early diagnosed malignant tumors. In late diagnosis cases, it will palliate or palliate and increase the quality of life. So, seeing the name of cancer, seeing the name of leukopenia, seeing the name of Malignant tumor, you will be afraid of. When the patient gives you scope, don't deny. Treat. And according to the situation, according to the presentation of symptom, according to the pathological state of the patient, you have to map, you have to decide, I will be constitutional or pathological or keynote or organ specific or dosers or anti-dosers or antibiotic drugs. That you have to think in my heart. What medicine should I give to this patient? Okay, so this is end of my talk for the first session. So my summary is that homeopathy has protection. I will have cure one case, but doctors are there cure several cases of cancer. So if you try very systematically with a good knowledge base, knowledge has to acquire. Knowledge has to, we have to go depth of methods to give such combinations. Read out. Second session. See, this is question asking that tarantula is so he has so what happens actually? Tarantula against the pain, patients have a painless, not patient will die, but the good quality of life
Not make the person that. Another doubt? Okay, so if you like, take 10 minutes gap, we'll have some couple of idea. For instance, we can discuss about spondylosis, no problem. Finish it. Interested don't discuss. The mind will not adopt. If you have questions, we can discuss, or some other time we can discuss. Are you like? Scroll that discuss. Very tough. Very tough. Approach is very tough. You will not accept. Why do you want to?
Thank you, Nanda sir, for that informative session on tumors. So we have an option here. So sir is saying phone a friend option. So you raise your hand if you want to hear. So sir is saying we should have another. So 5-10 minutes, sir.
10 minutes. 10 minutes or 15 minutes.
Is it okay? You want to hear about cervical spondylosis for about 15 minutes? So, okay.
You have a cup of tea? Then make it. And then we can continue. 5 minutes here. 5 minutes here, 15 minutes discussion. 5 minutes after 5 minutes, we get 15 minutes here.
Yeah. Since it's a very common clinical condition and most of our practitioners are adept at treating it, probably sir will throw a little light on few things that are uncommon. So probably 5 minutes you can take, sir, something different from the routine, and then we can conclude, sir. You can say something which is different from the routine that you use in cervical spondylosis for about 5 minutes, then we can conclude, sir. And one question, sir, all the tumors that we have discussed today, they are all exclusively homeopathic medication only, no, sir?
Only.
Yeah. So
they are poor, they cannot afford.
Right.
9 years, 10 years.
Correct, sir. Right, sir. Thank you, sir. So the stage is yours for spondylosis while your tea is arriving, sir. Or you can sit there and talk, sir. That's perfect. You can sit there and talk. That's perfectly fine. Sure, sure.
और कहाँ है? डेस्कटॉप कहाँ है? और एक फाइल है ना, ये यहाँ था, चला गया ना, डेस्कटॉप अभी आया था, डेस्कटॉप अभी आया था, नहीं इसको क्रॉस करना होगा, हाँ इधर था, नहीं हाँ, नहीं आता है, हाँ ओके, वही तो इन्वर्स करो इसको, हाँ so thank you for showing interest. I am so much senior persons are there. So much senior persons are there. So I am happy for your interest. So let us discuss for 15 minutes each chapter of 1 hour. But I am trying to just show you what is my approach. Okay. So this is important point to what is happening spondylosis. We take the spondylosis which has been damaged, we cure what happens, how it happens, and after what happens. What is not there? Let's see. So this is what is this? What is this? Vertebral body, yes or no? This is intervertebral disc, yes or no? Okay. So what is intervertebral disc consist of? What is the constituent of intervertebral disc? See here, annulus fibrosus, nucleus pulposus. Yes or no? Forgotten or it is there? Achha. So these two things, annulus fibrosus, nucleus pulposus, is the cause of spondylosis. So our focus will be on this. Okay. The intervertebral disc consists of three things: cartilage end plates, nucleus pulposus, annulus fibrosus. Yes or no? This is annulus, surrounding is annulus fibrosus. This is pulposus, and this is end plate. Nucleus pulposus between, this is annulus fibrosus. My point to tell you that, to be very brief, this is a spongy material, this is a hard material. So when any jerk, spinal column, this spongy material take the jerk, this annulus fibrosus is a hard material, will not allow this spongy material to come out. When there is a big jerk, this come out. See, this is the normal, this is one cervical, one vertebra, this is disc vertebra, this is a normal disc, see, good shape. And when there is a jerk, old age, the disc degenerated, disc comes out, it is, see, on the level, disc comes out, disc herniated, then disc thinning out, we are telling that the space reduced, disc degenerated, And lastly, osteophytic growth. The osteophytic growth are the cause of pain in the cervical spondylosis. This is the pathology. See, this is very important to follow for the homeopathic prescription. So this is the stages of spondylosis. First degeneration, then this is nucleus pulposus is prolapsing, then nucleus pulposus comes out of annular fibrous this ligament, pushes the spinal cord, and this is lastly breaks and pours into the spinal cord, causing severe myelopathy paralysis. Okay, these are the stages of, again I am showing normal disc, degenerated disc, bulging disc, herniated disc, damaged disc, space reduced, osteophytic growths. This is the pathology. Okay, this is the MRI report. See here, the disc, here the disc prolapse, pushes the spinal cord, and there is a gap here. These are the nerve supply. If the disc prolapse in the C4 cranial nerve root, C4 supplies pectoralis major. If the C4 are damaged, pain in the neck, chest, hand. If C5 is pressurized, pain in the shoulder, scapula. If C6, C7, C8 damaged, pain in the entire hand, pain in neck, radiates to entire hand. Yes or no? Sometimes spondylitis pain occurs in neck and chest. Sometimes neck in hands. Sometimes neck in scapula. Sometimes neck in shoulder. Why? According to the herniation of the disc facing the spinal nerve. The spinal nerve pushed. That concerned area is soft. Yes or no? The astonished to know only the science homeopathic medicines has got pain, neck and chest. Pain in the neck and nape of neck, chest and hand. Who is the clot? Cervical spondylosis, pain in the nape of neck, as if chest pain, cardiac pain, head. Okay, who is the clot? That is correct. See, it is correct. When there is pain in the nape of neck extending to the hand, the pain in the nape of neck extending to pectoralis, outside of the chest and hand, that is correct. Pain in the nape of neck extends upwards in terms of causing motility. Pain in the neck extends downwards. I will show you the charts quickly and benefit. Okay, so you just see the nerve distribution. If you have this idea, anatomical idea, C4 supplies pectoralis major, C5, 6, 7 supplies hand. When 5, 6, 7 nerve root, cervical nerve root compressed, hand pain. Okay, so likewise you see, investigation, X-ray, CT scan, MRI, you know all these points. Here you see degenerated stages you see. Three things happen. If mild spondylosis, cervical pain. If severe, more pushing cranial nerves, radiculopathy. If damage, there is myelopathy. Radiculopathy, many times you get a prescription that cervical spondylosis to radiculopathy. Meaning क्या? Radiating pain. Good. Pain in the nape of neck, tracing the spinal nerve root, radiating to other parts. This is radiculopathy. And myelopathy is when completely the spinal cord is compressed and causing paralysis of the lower limbs, hands. We cannot go detail. Approach. Same thing on totality, on keynote, on sphere of action, nodes, zigzag. So many studies have made that cervical spondylosis may be a cause for etiological factors like psychological stress, grief may cause cervical spondylosis. So, mental symptoms are also to be taken in treating spondylosis cases. So, I have studied two groups, one group given constitutional group, other groups where constitutional symptoms are lacking gives organopathic drugs. So, see, the main drugs in my study, Nox vomica, Rostox, Natromure, Chelidonium, Lachesis. We are all treating spondylosis.
Which is the drug, pain in the neck of neck, extending to both the arms. There are 4 drugs. Reporting, synthesis, pain in the neck of neck, extending to both the hands. 4 drugs are there. No, not showing that, Natromure, Brownia, reporting. Now, pain in the neck, extending to both the hands, 4 drugs, both the hands. Okay. Noxmonica is a best drug for spondylosis. Why? Now, Noxmonica is a best drug for spondylosis. Why? Ambitious, correct. Ambitious. Being ambitious, doing what? False posture. Misalignment of the spinal column. Misalignment. Or just sleep of this, pushing. Regular lifestyle, ambitious, night watching. Doing what? This posture, drinks, smokes, jealousness, all these small spondylosis. So Noxmonica, if indicated, not America, remember, if indicated is a best. Best drug, very natural. Persons today are sensitive. Yes or no? Very sensitive, very irritable, very muscularly, they are all in that. So their desires are has to be delicate, sensitive, irritable, not patient, has to be and to achieve muscularly. Lycopodium, around me, means okay. So Brownia, Chelidonium, all these drugs. Brownia is a good drug because slightest motion causes pain. Brownia. So this is in my study. Nox vomica, Rostox, Natromure. So let us quickly pass. Organospecific drugs, very, very helpful. Paris quadrifolia, radium brom, chinnum salt, lacnantis. Have you given lacnantis in your practice? Very good drug. Severe stiffness of neck. Oh, I cannot do like this. Severe stiff. Oh, serious pain. Oh, no, I cannot turn my head. Lacnantis. Okay, important rubrics in the in your repertory. Pain cervical region, right, left, pain in night, pain cervical region, bending forward. These are all in repertory. So let us pass quickly. These are very good rubrics for spondylosis. Pain in pain extending to arm, Brownia, Chelidonium, Natromure, Nox, what I told. Pain extending to left. See, bus. Just remember. At least remember this slide. Pain in nape of neck. Chalo, You can also see the technique and see pain in the neck extends to both the hands. Next, tap. Oh, next slide. Next slide, tap. So I have told you symptoms. See, always in the practice, I advise you to be a good practitioner. Be a very good practitioner. Okay, so to be a good practitioner, always keep in mind what is the basic symptom of the drug, what is the determinative symptom of the drug. Basic means common symptom, determinative means who is the individual, individualized the right from other individuals. Basic symptom is common symptom. Pain in the hand and extends to left. Camia, Paris squad, radium. चलता है okay.
Okay, so in Nox vomica, basic symptom is Nox vomica. Important symptom is one symptom. Remember, pain in the neck while sitting, and pain in neck extends to both hands in Nox vomica. While sitting, remember, I have to make it bold. And determinative means the individualizing symptom, you know, quarrelsome, ardent, jealous, envy, etc. So likewise in anatomy, you know, I am just coming to key points, but you see this slide. Pain in the neck extends to left hand. You must remember Paris squad, Kalmia, rhodium, hydrogen. Okay, pain in the nape of neck. These are all in the repertory. Pain in nape of neck extends to right hand. Solanum lycopersicum, ferrum peak. Okay, so see the difference. Just you see, attention is riveting, na? Just to listen very close. See, I'm just passing quickly. Paris squad and Kalmia, both are pain in neck extends to left hand. In Kalmia, only hand. In Paris squad, hand and chest both. Okay. Just to see slide. 15 minutes I'll go. Lot of things to tell. I'll give you the PPT PowerPoint presentations. I'm just showing you the important slides. See, there is a this is a good slide, you remember? Many times spondylosis accompanied with vertigo. Yes or no? Yes, sir. So drugs are Chinnum salt, Bambosa, Eupatrum purpureum. Whenever you get a drug that I have got spondylosis and chakkar hota hai, बहुत severe vertigo. Either think of Chinnum salt, Bambosa or Eupatrum purpureum. Okay, Chinnum salt, only one point is that there is a tremendous tenderness of the C7, cervical 7. Bambosa, like lacnanthesis, there is coldness between scapula. Which is the other drug? Coldness between scapula. Can you tell me? Warming between scapula. Which is the drug? Coldness between scapula. Which is the drug? Lacnanthesis. Bambosa. Okay. Weakness between scapula. Between scapula. Can remember? Just remember, 3 drugs are there. Cervical spondylosis with vertigo. 3 drugs. Remember? Chinnum salt, Bambosa, Eupatrum purpureum. How to differentiate there? I'm just showing you slides. You are losing your concentration. Pain in neck, looking off. 2 drugs. Sir, when I do like this, severe pain. Formica rufa, graphitis. Looking down, Radium caliphos triticum bees. A good slide. Pain in neck extends to shoulder, left shoulder, guacum, indium, asparagus. Pain in neck extends to right shoulder, lycopodium, caliphos. They have to differentiate it there. This is a good slide also. Pain in the neck extending to right deltoid, left deltoid, next muscota, right deltoid, lycopersicum esculentus, pisoliba, cerulix. These drugs are all available and very fantastic. Pain in the nape of neck, extending to scapula, cynopodium glaucia apis. I will tell you a good story here. So I have tremendous pain from I have tremendous pain in the left scapula here. So I asked him, how your school? He gave me a star. And the chief minister asking how your school? I am very like pain is here. You are asking me how your school? Are you angry or not? Are you glad fellow? So it was disappointed came back and he has told me same subjects. So without any symptom, because pain in, remember this is very good, pain in left scapula, inferior scapula, left scapula, cynopodium glaucia apis, pain in right angular, cynopodium. I am repeating again, pain in left scapula, cynopodium GA, pain in right scapula, cynopodium A. So I said 3 quarters cynopodium glaucia apis, because by every key of that. So he is so happy. So he told that I scolded the doctor, call him. So he asked me, what do you want? I told sir, I am instructed for this. So I want my students to be encouraged. What do you want? Tell me. I will get what is it. Okay, done. So you have to tackle. You can't ask how you we cannot help, but situation like that, we cannot help. Okay, so but it is pain in the neck, spondylitis with vertigo will get many cases. And chinnum solve with the drug, chinnum solve when there is a tenderness of the C7, hypertension part when there is diabetes, more urination. So similarly, see pain in left, pain in scapula from neck, cynopodium glaucia apis, gincum chrome, right scapula, jugular cinerea, oleomani, and cynopodium antihelmiticum. But at least remember left scapula, cynopodium GA, right scapula, cynopodium AH. At least remember. And this is Nox muscata. This is sticta. This is sanguinary candensis. This is ferrumpic. Both are syphilino. Anywhere you touch, one point will come out. Anywhere in the body you touch, one point will come out. No signs like this. No signs. So these are all beautiful differentiation point. How to differentiate? But it is not. Yeah? So I'm just concluding the symptoms. But please read my PowerPoint presentation or how to differentiate in one line. Cynopodium glaucia apis, cynopodium antihelmiticum. Hypertonium pork, bambosa, and chinnum sulf. How to differentiate in vertigo? One line I've given. Please read it. So, constitutional prescribing based on totality is best for cervical spondylosis. I am telling you again, being a homeopathy doctor, if you at all miss a case of cervical spondylosis, you are lost. You are very lost because these cases will bring name and fame from you. If you know this topic perfectly well, if you know the perfect pathology of this topic, you can definitely cure. Brownia, Chandronium, Natrium, Noxonica, when extend to both arms will help. When extend to left arm, Cambia, Paris part, William group hydrogen. When right arm, Solar Lycophysical therapy. Therapy is a drug for spondylosis of AJ and ESP. Therapy is a drug for degeneration. In old man, BPS and degeneration. Spondylosis is therapy. Solar Lycophysical is a drug for tomato. When there is a allergic sneezing, this select spondylosis. They are there, I have written there. So, always try to treat consistently on totality of symptoms. If not, go for chemo. Chemo means when there is pain, there is vertigo. So, cases are coming with clear totality, keep consistent. Cases are coming, no clear totality, but a very peculiar keyword, depend on that. Cases are coming in advanced stage. Okay, there is no totality, no keyword. Go for or
organo-specific area wise. I have told you right shoulder, sinus area, right scapula, chinapodium anterior, left shoulder, therapy, left scapula, chinapodium, Homoeopathic. Okay. Go up. Okay, likewise, go for organ-specific. Okay, and if there is no organ-specific, go for nodures. Nodures, when remember psychotic compound, the bowel nodule is a very, very effective weapon for human parts. When Rostock's Heromet, Thuja indicates what fails. In one patient, 3 drugs indicated, and symptoms like Rostock's. Aggravation, pain in about neck, aggravation, fast motion, aggravation in that weather. Rostock's not working. Government like slightest sound irritates government syndrome. Pain in night. So Rostock's, Thuja, government indicates in one patient with fast motion aggravation, damp cold aggravation, Rostock's not working, government not working. Go for psychotic compound and give a guarantee. Give a guarantee. When there is lack of leg along with numbness of hands, Kalmia indicated, not working, go for Proteus. Please go and read today the books. Proteus, there is spondylosis with numbness. So when there is sciatica with numbness, Proteus. Spondylosis with numbness. Kalmia fails, Navarium fails, go for Proteus. Lycopodium indicated in the dyspepsia, fortune aggravation, not working. Go for absolute. Morgan Pacnol, sulfur indicated for IBS, not working. Go for Morgan Pure. If you have an iron skin, please go today. At the page, foundation collateral medicines. Okay. Proteus collateral is natural. Psychotic collateral is, as I have told you, Ferromet, Rostock's, Thuja. Okay. So likewise, so remember the barbers are not only 8 drugs are there. Border cancer, border pilo, dysentery, maximum arterial fails in anxiety neurosis. Think of dysentery 4. When arterial from Jelsinum, Silesia, Lycopodium, which are drugs for stage 5, which are drugs for nervousness, are indicated. What fails? Go for dysentery. What do you do? These are the all tips to describe consistently. You can apply your practice like that. Don't let it go off. That is my pleasure. I lost today at least 45 rupees. Only because to discuss, interact with you and to increase your practice. I come once by Dr. Sampatra. That time also we are discussing a lot of things. Students are very happy. All the delegates, though not in much number, all are very interactive, still active. 3 hours passed, so I am happy with the audience. Thanks to the organizer. President Dr. Surya.
Yes, sir.
Surya, who become being an eloquent because of his death, cured so many cases. Introduced association, and lastly, I am salute to this association who is maintaining a distance here and maintaining. Thank you.
specific drugs.
Very question. Question that for keyword specific potency to be adopted. The question there, I'm again telling you, if there is both indicated higher the potency, both indicated 11 potency, both indicated consistent locality is very clear. 11 potency, centesimal high potency, less indicated keyword organ specific, organ pincher 6, 3x, 3 like this. Because higher potency keywords, lower potency tags. So organ specific means again I'm telling keywords organ specific can vary. As long as you go on giving children clouds at least for left cover then varies. If you are lucky, sometime after giving children clouds at least for 1 month or 1 month, this may lead to practices which are medium deep left side drug. While giving children for right side like Gouri. Okay, right. So it will not lead to any polygus. After giving parenting drops, it leads to a polygus, key polygus. So if indications are not very clear, no. Indications are clear, 11 followed by 5.
Sir, it would be great if you could share your mobile number and email ID, sir. It's there in the invitation. So definitely we would, sir, come back with few more doubts and queries through email, sir.
I am sleeping at 12 night and you accept at 3 a.m.
My
Because
God.
I am seeing 80 questions per day. Out of which 30 is new questions, 50 is 20 questions. I have got 6, 7 assistant. So I am going to sleep at 12 night, you accept at 4 a.m. So
That's
see
really
like
good.
that.
Sure. Thank you, sir. I'm sure all the audience over here, we are all very happy to learn from you. We got a plethora of knowledge, sir, which we could go back and apply in our day-to-day practice. I would request Dr. Venugopal Gouri, sir, to offer a vote of thanks.
Thank you.
Around 400 persons in class, but not so interactive session. Interactive knowledge, interaction problems. So once you increase that knowledge, don't be complacent that I now 10,000 knowledge. Don't be complacent. Go on, question. Homeopathic science is question. Go on, deepening question more and more. Have more knowledge. Right.
Thank you so much, Dr. L.K. Nanda, sir, for that beautiful exposition of your treatment on tumors and also cervical spondylosis. Indeed, as the dusk of Pitru Paksha falls over our subcontinent and as we respect our ancestors, I think this is a befitting moment of respect that we have for the founder president of our association, Dr. Jayasuryaji. I'm sure his soul is one with the supreme soul, and Dr. L.K. Nandaji has given enough prayers in the form of wisdom to all of us that the same soul is on the way to reach the Almighty. As a matter of fact, the celebrations of Navratri also begin this evening, and the celebrations start with the wisdom that Dr. L.K. Nandaji has shared with us. The way he has been treating his cases of all kinds of pathologies, and the way they have been again shown to the medical fraternity in the form of pathological reports that have been reversed. Indeed, sir, it was one of the best sessions that we've had in recent times at Homeopathic Medical Association of Telangana. And we are very happy that our good friends, our Vice President of the Association, Dr. Manik Prabhuji, has been a sponsor for this evening's meeting, and also our Shilpa Endowment Trust, who have always encouraged us to conduct the Jayasurya Memorial Oration. and the other friends and participants that have been of great help to us. And I'm sure all the doctors here, all the medical fraternity here have been enriched further, inspired further in the path towards a better clinical practice in the days to come. And we thank the good officers of our past president, Dr. Sampath Rao sir, and all other seniors who have come here this evening and made this a great success. Thank you so much. And let us all stand for Janaganamana. National anthem, please. Janaganamana adhinayaka jaya he Bharat Bhavya Vidhata Punjab Sindh Dravida Uttara Banga Vindhya Himachala Yamuna Ganga Uchala Jagasitaranga Tava Shubham Tava Shubham Jaya He Jaya He Jaya He Jai Hind. Please come over to the stage to have a snap with our esteemed speaker.
Yes. is provision.